So hello guys, this is a case of GTC, generalized tonic-clonic seizure. So there is this 9-year female child came to a casualty at 9 p.m. presenting with the complaints of one fever spike that morning. Second one, she had one episode of vomiting at 4 p.m. which was non-projectile, non-bilious. 9 to 10 minutes post-vomiting, she had one episode of convulsion involving all 4 limbs, rolling of the eyes and frothing from the mouth, post which 45 minutes she became unresponsive. This is a case of fever-triggered convulsion. Let us see what triggered convulsion. So let us say that this child have been basically exposed her immune system to various different types of pathogen. This pathogen, once entered into your body, interacts with the macrophages, and this macrophages represents the piece of this particularly pathogen called as an antigen to your T helper cells through your MHC2 complexes. Now this your T helper cells specifically interacts with the antigen through the CD4 positive proteins, generates an interaction after which there is a release in 1 interleukin 6 and tumor necrosis factors. Now the cytokine specific ability to stimulate the specific receptors present on your new. Now this receptors becomes hyperactive, sensitivity increases. Now there is another neuron called as a glutaminergic neuron which releases a glutamate, stimulates your NMDA receptors. So as it is hyperactive and its sensitivity is increases, the minor amount of a glutamate can actually provoke its particular action. It stimulates the particularly specific receptors that are NMDA receptors. It causes the influx of positive ions causing the depolarization. And this depolarization further increases the action potential which fires the neuron, generating impulse transmission which is continuous and seamless and basically leading to a convulsive. Let us see what will be the management of the fever triggered convulsion. So this child was given with 2 types of drug classified under benzodiazepines and antiepileptics. So the benzodiazepine, also called as a sedative or a hypnotic drug, which is midazolam. Now this midazolam hypnotic dose of 7.5 to 10 mg was administered to the child, generating a sedative effect by acting on a GABA A receptors into the CNS and basically increasing the influx of the chloride ion and increasing the negative charge into the neuron and hyperpolarizing the cell, thereby preventing the impulse transmission and sedating the body. Classification is anti-epileptic. Drug of choice levetiracetam 20 mg per kg was administered to the child, which actually generates the anti-epileptic activity by specifically acting on SV2A receptors, special type of synaptic proteins which actually modifies the release of glutamate as well as GABA and hereby generating the anti-epileptic activity, prevents the impulse transmission and firing of the neuron. The child was further managed with the anti-epileptic drug to prevent the convulsive triggers. Thank you. Follow for more.